And Abe, he loved working in the clinic because he loved seeing kids. He loved taking care of kids, but he also loved being with residents and teaching residents in the clinic. Even in his late 70s, he was still working clinic and work on the in the wards in the clinic at Harborview because he really loved medicine and loved pediatrics.
Bedside rounds were a real treat with him, um, because he would often have the resident do the exam. It wasn't like your dad would do a whole lot of the exams when I was there, but his fund of knowledge and his understanding of the history of medicine and his ability to connect where we got to today, why treatment today looks so different than what it was before, was really refreshing. And I realized over time that's an anchor that we get as people in training in the medical profession. You can read the latest protocols for how to assess and treat diseases. You can do what is now sort of au courant. But if you're divorced completely from how we got here, if you forget the history of medicine piece of it, and you don't have an appreciation for the struggles that got us to where we are today, you don't have much of a foundation. Before patient-centered care was a thing people talked about, before making sure including the family in discussions of treatment like quality of life or goals of care, he was doing that. He was doing it in his own way.
Well, yeah.
Nobody would have mistaken him for a palliative care physician sitting down, allowing these pregnant pauses to take time until somebody came up with their own ideas. But he really, really was focused on the patient and the family. And he understood if you don't include them in this process, and you're not addressing the concerns and questions they have, even if you don't think it's relevant, that itself is something you have to get over. Because if you haven't addressed their questions and needs, no matter how great a job you think you've done, you have failed.
The core, he was a doctor, and he, like me, really took his ideas of what to work on from what did he see, what patients did he see in the wards or in the emergency department. I mean, remember that one of the things he's most famous for is the Flammable Fabrics Act. And that was really from a patient that he took care of at Children's.
Yeah.
Before there was a separate burn unit at Harborview, these kids came to Children's Hospital and took care of a little girl whose nightgown caught on fire when she was close to I think, a gas stove or a flammable stove. And so that really seared in his mind that needs to try to do something about it. And that really led to the Flammable Fabrics Act. I think that the same thing with the Sudden Infant Death Syndrome Act, that was really from taking care of these kids and seeing those patients and those parents in the emergency room, that really led to him trying to do something about Sudden Infant Death Syndrome. It was really that his identity as a physician, taking care of patients, working with residents, that really drove Abe to do the work that he did.